This chapter, we will learn neoplasia. Now let's see some pictures. First, let's see this picture. This is a female patient. We can find a mass in the breast. On the cut surface, this tumor is white. So this mass is a tumor. If a tumor is a benign tumor or malignant tumor. If a malignant tumor is early or at one advanced stage. So this is a questions. Now let's see this picture. This is a boy. We can find a mass on the face. This is a malignant tumor, lymphoma. This is a lymphoma. Here we can find another malignant tumor. This tumor are on the eyes. It's a black. It's a black. This is a malignant. This is a melanoma. And here we can find multiple masses in the liver. This is a hepatocellular carcinoma. And this is a big mass on the palm. This is a synovial sarcoma. And this is a neck mass. Neck mass. This is lymphoma. And here we can find the arm mass, face mass, very big, and it's red. This is a hemangioma. And here we can find a black mass on the foot. Here, this is another picture. Black mass. This is the melanoma. And here we can find multiple masses on the human body and face. This is the neurofibroma. And here we can find an ulcerative mass on the face. This is a squamous cell carcinoma. This is the colon. We can find a polypoid mass. This is the adenoma. This is an ulcerative mass in the colon. Cauliflower-like mass on the colon. These are all adenocarcinoma. So these tumors, most of these tumors are malignant. So this chapter, we will learn neoplasm. The major objectives are following. First, we need to master the concept or definitions of neoplasm, atypia, tumor growth and spread, dysplasia, carcinoma in situ, and we need to master the invasion and metastasis, the differences between benign and malignant tumor, carcinoma and sarcoma. We need to master the nomenclature and the principles of tumor classification, and the pathologic and clinical features of common tumor, to understand the etiological factors and molecular basis of neoplastic transformation. Section 1, definition and morphology. Now let's learn the survey of tumor. Neoplastic disease, often called tumors or cancers, are diseases in which there is an uncontrolled growth of the tumor a group of cells. These new cells form tumor tissue masses we call tumors that compress, invade, and replace normal tissue and organs. Tumor growth causes significant effects on human health or even death. It's the first cause of the death, both in Chinese city and countryside. This is the 2015 years data. Estimated about 5 million new cancer cases and 2.8 million cancer deaths occurred in China. In China, about 1.7 million patients die of cancer every year. This picture, we can find 5 most common cancers of China. According to the cancer incidence, the 5 most common cancers are following. The first place is lung, breast, stomach, colorectal, and the liver. According to the cancer mortality, the first place is the lung, liver, stomach, esophagus, and colorectal. Now let's learn the definition of neoplasm. You need to master this definition. New growth. Neoplasm means a new growth, often in the form of an abnormal tissue mass due to clonal, excessive, and autonomous proliferation of cells resulting from genetic alteration. So, neoplasm means a new growth. A new growth usually shows tissue mass. The growth is uncontrolled. It persists in the same excessive manner, often the cessation of stimuli evoke the change. So the growth is uncontrolled. The features The features of neoplasm are following. The first is nucleus. The second is abnormal tissue mass. The third is excessive proliferation. The fourth is clonality. The fifth is autonomy. The last is genetic alteration. So the neoplastic lesions are uncontrolled. The growth is uncontrolled. So neoplasm means a new growth. Neoplasia means a process of tumor formation. In common medical usage, a neoplasm is often referred to as a tumor. So neoplasm is the same as the tumor. The study of tumors is called oncology. In oncology, the division of neoplasm into benign and malignant is very important. This categorization is based on a judgment of tumor's potential clinical behavior. Malignant tumors are collectively referred to as cancers. So cancers means all malignant tumors. If the tumors tend to grow within normal tissue boundary, and we call this is a benign tumor. However, tumors tend to acquire the ability to invade and replace normal tissues and to spread throughout the body. These tumors are termed malignant. So malignant tumors show invasive feature. They can destroy the normal tissue. They can show distant metastasis. Now let's learn the distinction for other types of growth process. Neoplasia, the process of tumor formation, is different from hyperplasia, metaplasia, and dysplasia. Hyperplasia is an increase in the number of the cells in an organ or tissue occurring in response to a physiological or pathologic stress. Although the cells increase in number, the growth is controlled. All these cells are normal, are mature. So this is very important feature is controlled. The growth is controlled. Hyperplasia. The second term, metaplasia. Metaplasia is a reversible change in which one adult cell type is replaced by another adult cell type. So metaplasia is a protective reaction. The last term, dysplasia. Dysplasia is a term used to describe disorderly but non-neoplastic proliferation. Dysplasia is incumbent. It occurred in the epithelium. It's a loss in the uniformity of individual cells and in their architectural orientation. Dysplastic cells exhibit considerable pleomorphism and often possess hyperchromatic nuclei that are abnormally large for the size of the cell. Mitotic figures are more abundant than usual. Dysplasia without qualifications doesn't indicate cancer and don't necessarily progress to cancer. So dysplastic proliferation doesn't mean neoplastic lesion. Mild to moderate changes that don't involve the entire thickness of epithelium may be reversible. Okay. This is the development process of malignant tumor. The normal cell transform a neoplastic cell, then proliferative, and show local invasive growth pattern, destroy the local normal tissue. In the advanced stage, they will show a distant metastasis. The biologic feature of tumor, there are two features. The first is immature or undifferentiated. Biologically, tumors are usually composed of immature cells, like the structure or function of normal mature cell of the same type. So if a neoplastic lesion, we can find immature feature. Maybe the cell immature, or maybe the architecture shows immature. The second feature is uncoordinated. The growth of the tumor cell is uncoordinated. Neoplastic cells continue to replicate, and the neoplasm enjoying a certain degree of autonomy and more or less increase in size, regardless of their local environmental and the nutritional status of the host. Okay, so that's all for the definition of neoplasm. You need to master the definition. What's the neoplasm? What's the neoplasia? And the the differences between neoplastic lesion and the non-neoplastic lesion. And you need to master the two features of two behavioral features of neoplasm. The first is immature. The second is uncoordinated. Okay, that's all.